Dr. Heidi Goodarzi is a pediatric dermatologist and dermatologist who helps babies with their skin conditions, but also helps moms look and feel their best. And Heidi, I've seen you do CO2 lasers, you've done Botox, you do facial filler, and this under eye filler is specifically what caused this vascular occlusion for Lilly Ghalichi. Tell me, what is filler like? What is the protocol when you do filler in your office?
Hi, Cassandra. Thanks for having me. Yes, I have been doing cosmetic dermatology since 2008 in residency, and then since 2011 in my practice. And I think I actually try really hard to preach this, that filler is actually one of the most dangerous procedures we do, because the idea of injecting a filler, first, is that we inject it because we want to replace a volume that is lost, right? So that volume of bone, fat, that we lose as we age, we replace it with some filler. Most of the fillers specifically related to this case that we're going to talk about today are hyaluronic acid, which is a sugar compound. You inject it into the deep dermis, deep layers of the skin, and then it kind of holds water and it gives you the volume that you lost back and fill those places that we all have indentations or a little divot on the face.
Yeah, and you mentioned that this is also to help replenish any volume that is lost. Where do you inject fillers most often? What's the most common, and what are the reasons why?
So you can inject it basically anywhere that you've lost volume. So we started with like laugh lines and lips, and then we did the cheeks, and now we do a lot of temple area, chin area, jawline contour, under eyes. We do use different forms of fillers because their viscosity and their other characteristics they have are different. So like more thicker fillers, more durable fillers when you're trying to replace bone or place the filler on the bone, and then more lighter fillers when you're trying to do delicate areas like the lips or under eyes. But the challenge with injecting a gel, so hyaluronic acid is a gel, right? Injecting a gel into the face is that there are all sorts of blood vessels that are going through our face. And some of them are small, but have really important functions, like providing nutrients and oxygen to the cells in our eyes. So if you block the flow of blood to these vital arteries that feed these vital organs, then you run into a problem. So sometimes by injecting this gel into a blood vessels, which you don't mean to, but let me just clarify that blood vessels don't read textbooks, so everyone's blood vessels have a different position and location that isn't necessarily what you saw in the textbook or in the anatomy lab. Yes, we do look at these arteries and veins and nerves and where they're located on human cadavers, but that's just one person, or that's just a few people. That doesn't mean everyone has the same anatomy. There's a huge amount of variation. And also there are so many of these arteries. So you take a needle, and this is usually done blindly, meaning that we don't have imaging studies that goes with it. Based on our knowledge and experience, you place the needle and you take measures to avoid injecting into an artery. But if I want to be honest, there is no way to 100% guarantee that you won't run into trouble when doing fillers. And that's not just fillers, that's every medical procedures we do. Have you ever heard of someone doing a surgery and saying there is no risk to this, 100% safe, come in here, we'll put you under general anesthesia, we cut on you, but you're going to walk out safe? No.
I wouldn't trust that, doctor.
Right? There's always risk to procedures, but somehow injecting fillers, which is a medical procedure meant to be done by medical professional physicians, board certified physicians in the core specialties of dermatology, ophthalmology, plastic surgery, ear, nose, throat surgery, all of a sudden became so trivial because it just doesn't look as dangerous. So now a lot of people are injecting it without just kind of understanding the significance of a problem that could happen. The second most important thing after training and consideration and expertise is knowing what to do when complications happen, right? The challenge here is knowing that your injector is aware of the complications, knows what to do if they happen, and has the infrastructure to deal with it. So I am so appreciative of Lilly that shared her story so openly and went through step by step what has happened, because one is that she showed us what could happen and what are the dangers of this procedure. Two is that she showed us how stressful and how involved dealing with this side effect is. 3, she showed how emergent and urgent this issue is and how we need to seek help from the experts immediately to make sure we can reverse this. Otherwise, the consequences could be catastrophic. And I wish for every patient that has any problem that they would be as privileged as Lilly to have all these amazing doctors who helped her, all these amazing teams that came in and helped her. But the reality is that not everybody will have access to this kind of care if this complication happens. So you need to make sure your injector has all this infrastructure in place.
Yeah, and it's rare that we get to see this. First off, celebrities don't always show us what procedures and treatments they've gotten. And then for her to not only share those treatments, but also what can go wrong. Like you said, you could have the best of the best, but something could go haywire. And that danger, you said that this is a very common procedure, but it's also one of the most dangerous. And it's because if you have someone who, like you said, doesn't have that infrastructure, what are we supposed to do? And let's actually talk about that. What is the protocol for when things go wrong? Hyaluronidase is this enzyme that breaks down hyaluronic acid, but if somebody had this vascular occlusion, what are the options? What are those first care things? And a lot of times this has to be done by plastic surgeon, ophthalmologist, emergency medicine, dermatologist. Someone at a med spa, even a nurse, might not have the ability, the infrastructure, the medications, or the training to know what to do when things go wrong. So what is that treatment protocol when you have, a vascular emergency?
So a lot of it is recognizing it and also being informed of what are you looking out for. And I heard a lot from my colleagues that, scenarios went on, like the patient called and said, oh, I have some bruising. And maybe the front desk person said, oh, it's normal. I hear doctor tell the patients all the time they'll get bruising, and not really recognizing the right questions to ask to evaluate, is this normal bruising or is this something else going on? So that's the first thing. Read your informed consent, right? Ask your doctor what are the risks, which they're hopefully going over. And then what are we going to do if something like that happens? I get fillers, like we all move with a little bit of cautionary kind of fear, but it is a great procedure. You just have to ask the right questions and know who's injecting. So unfortunately, I've heard of many cases, including legal cases, where something was done, but the injector wasn't available when the side effect was happening. And that's not just for filler, for surgical complications or anything. You want to make sure that you have access to your doctor or a covering physician so you can actually reach somebody. It is still not 100% that these measures we take are going to reverse the problem. There are things we do. The most important one is injecting the dissolving agent, the hyaluronidase, into the area. And again, none of us are going to be able to find that particular blood vessel and inject right into it, right? Because we don't actually know where it is and we're not doing imaging. So what we do is usually we inject the area enough and hoping that we would dissolve enough of it that the blood flow would resume. So that sounds a little bit like not super scientific, and that's actually how it is because we don't exactly know. And that's why, we start with like 100 units, 200 units of hyaluronidase. And as you saw in Lilly's case, they went up to 1,200 units. Going back to how I said you're right, that sometimes the nurses or even doctors wouldn't be qualified to do this and you need a team behind you, is that sometimes you actually need to inject it retrobulbar, meaning that you need to inject it from inside of the lid behind your eye. Right? So that's not something that I feel comfortable doing. And you're right, you do need an oculoplastic surgeon or an ophthalmologist to do it. So you do want to make sure your doctor has all of that in place for an emergency ophthalmologist or oculoplastic surgeon to be on board, to be able to help when you need help. So that's also really important. So there's a lot of different measures. And then there are topical medications that kind of make your blood vessels get a little bit dilated, kind of like what we take when we see a heart attack issue. It just makes the blood vessels kind of get a little bit bigger. Are they 100% effective when you apply them topically? We don't know, but some people use it, and we consider it. Basically, we do everything we can just to reverse the side effect, because eventually we're afraid of the skin not getting nutrient or oxygen long enough that it will die off and it would just be black and fall off. Or the worst case scenario is that the eye wouldn't get enough nutrient and oxygen and then the person would go blind.
And that's just such a huge price to pay for beauty. And again, there are things you can do to mitigate that risk, but nothing is risk-free. Like you said, informed consent is first, making sure that the practitioner is licensed, certified, has a team behind them, and has experience in this. Number 2, noticing when it is a bruise or a hematoma. This is like blood that pulls up under the skin, but that is very different from this cold to the touch, this losing color, this fast changing color, this purpleness or blackness, right? Hyaluronidase to break down in the entire area, any of that filler that's still there and occluding that vessel. Then, like you said, vasodilators that can really hopefully help open those up. Now, you mentioned imaging, and I actually have a question about that. I know that an MRI could help, see things, but you probably wouldn't have time or even a lot of access in private clinics to an MRI machine. Do dermatologists and doctors, do you guys ever use vein finders or things like that when injecting, some of these infrared or other wavelengths to visualize blood vessels under the skin, since, every single person has a different body shape, eye color, hair type. Same with inside our bodies, everything doesn't go as textbook.
Yes, we do use vein finders, but this is a problem of arteries, and the vein finders only find the veins. And I see a lot of practices, especially on social media, kind of market that, but that only prevents bruising. That doesn't address this issue, because we need to see arteries. And if you need to visualize arteries, you need to do angiograms, like MRIs with dye. So no, nobody's doing that to inject fillers, but I've actually asked this from a lot of radiologists about how we inject versus how interventional radiology does other injection forms. So for example, in kids, we have vascular malformations, and we need to inject a dye inside of it, or a compound that kind of kills the vascular malformation. So it collapses instead of getting bigger and causing problems. And there is imaging with ultrasound, visualizing exactly where we want to go, and then we inject a dye in. So I've had this conversation with interventional radiologists, and I say, well, in addition to pediatric dermatology, I also do cosmetic dermatology, and we just kind of blindly go in and inject and hope for the best. I'm being a little bit joking, but it is kind of true. We just kind of go in there and inject. Literally, the interventional radiologist was like, wow, I had no idea. And it was like, yeah, that's common practice. And half of the people who are doing it, or more than half, are not even physicians. So he couldn't believe me. And I said, this has been a common practice. He's like, well, thank God my wife isn't into it. That is the question. Why do we not have imaging? So the issue that I think me and most physicians have is that these products, these injection syringes, should not just be handed to anyone and everyone who took a random course, who took a weekend course, who took a 1-month course, and now they can legally get access to these and inject them. The bigger problem is that those courses are usually sponsored and kind of put in place by the same company that sells the syringes. So you can see how it's a business cycle, right? Let's train some people very briefly, then sell them these products, and then make more profit. This should not be like this. You got to have the proper training. Nobody gives a colonoscopy machine randomly to someone who took a course, but somehow injecting into face, which is the organ with the most number of arteries and veins and nerves and vital organs, like all of a sudden taking a needle to it just became so trivial. And I do blame social media hugely for this and trivializing this medical procedure. And I think it's great that people like you, and to the extent that the physicians can be on social media, are spreading the right message. So I'm very appreciative to you. And now, again, I can't even thank Lilly enough for coming out. This is such an important message. Millions of people being exposed to this and then sharing it to other people. That's how the right message gets out.
Yeah, and just raising that awareness, because like you said, 16 hours and $1,500 doesn't allow you, shouldn't allow you to sit here and claim that you're an expert in doing these, especially when, like you said, this is literally blindness, death, tissue necrosis, things can go wrong. And it's all about that risk benefit analysis. And if you have a much higher risk because you don't have imaging or you're brand new, that's terrifying. And if you're not being trained next to a dermatologist, a cosmetic dermatologist, a plastic surgeon, this stuff is absolutely terrifying. And like you said, it can cause really long-lasting damage. And I totally agree. Just the fact that Lilly speaks out about this, I understand that a lot of celebrities don't want to, and I respect that is their body. But if you're using your body to sell us things, I'm like, well, do we have the right to know? But the fact that she's so open about what she gets, but also the things that go wrong, most of the times this all happens behind closed doors, patient confidentiality, right? So the fact that we can actually see this, and this tells, a young 16-year-old who's thinking about fillers, okay, maybe I shouldn't go this weird, hotel room budget route, because that seems perfectly fine, especially because it's all over TikTok, right? It really helps us to prevent the $35,000, the $90,000 medical bills from having to prevent this vascular occlusion and, get an ocular surgeon in here to deal with the consequences.
For that 16-year-old that you mentioned that is seeing it on TikTok, the one important lesson, again, I want to emphasize that we're going to take from this story is that we don't know who injected this filler, but just let's say that 16-year-old, that 20-year-old, that young person who is on a budget chooses to go to a person that is cheaper and it's more affordable and get this procedure done. That's what they're doing because, it's affordable, they can do it. But then pay attention to when it came to rescuing the problem. We're talking about UCLA's oculoplastic surgeons. All of a sudden, then we all would want the expert, the physician. The oculoplasty is a subspecialty of ophthalmology. So you got to be a medical doctor. So that's 4 or 5 years. You got to do a general year of medicine. That's 1 year of residency. You got to do ophthalmology residency for a few years. And then you have to subspecialize in oculoplastic, which is another 3 years fellowship. So you're talking about decades of education. And then I'm sure these doctors who helped her have many years of experience. And then there wasn't just one, right? So when then the problem appears, then all of a sudden everybody would want the expert of the expert and expertise comes into place. So we got to backtrack and say, we got to start with people we trust to rescue us, to inject us too, because again, not everybody will have access to this kind of care, unfortunately. And if we start with the correct person who already has the infrastructure, our chances of having a good outcome increases significantly. I can't tell you how many times we see bad outcomes when something bad happened because a non-physician did something, which is fine, which we all kind of approve of. But the challenge was that the physician wasn't on premise to supervise or didn't get to the problem fast enough, right? So I don't want to just blame the non-physicians for doing it. For every non-physician who does something wrong, there's a supervising physician who's doing something wrong, right? So you either have an independent practitioner or a physician, then you want to ask what is their kind of protocol for this, or you have someone who's doing it under supervision of someone, then you want to ask where is that person and what would happen if there's a side effect and how available and accessible they are. Please do not trust the building and the white coats and things like that. Really ask the deep questions. Don't be afraid to ask questions. And don't ever hesitate to say, I'm sorry, I changed my mind. I don't want to do this today. And walk away. It's your body. It's your...
Exactly. It's totally fine to change your mind, to walk away, to find a new physician, or to say to, let's say like nurses can be excellent injectors, but to say, hey, I really would like the doctor to get back from lunch before we do this. You have every right as a patient. And I think it's so important to speak about that patient advocacy, because remember, at the end of the day, the patients are paying the doctors, and you deserve to have your needs met. You deserve to have your questions answered. And, doctors are humans too. And sometimes we don't get along with everyone. And sometimes, we all have amazing snarky personalities and we get along better with some than others. And I think that's really, really important to have that connection with your doctor so that when something does go wrong or something scares you anywhere on your body, you feel comfortable opening up about that and solving it. And Heidi, knowing that you are an amazing doctor who helps kids and their moms, and you've been doing this for many years, what are some of the most common questions that you get from patients asking about fillers?
So I don't have many people ask actually the right questions. Majority of people, when you hand them a consent form, they just sign because they already decided to trust me. So I'm always hoping that is because they've already read about me, they already know my work or got a referral, or somehow they're aware to trust. But it's always good to read that paper, right? There's a reason someone hands you a legal document to sign, because these are all mentioned there. So it saves both the doctor and the physician. So we're actually responsible for going over it verbally. So I always go over it and I say, I know it sounds scary, but these are the potential side effects that you need to be aware of. Tylenol, when you give it to your kids, there's a potential side effect of liver damage. So be aware of that, right? Fillers, there's a potential side effect of skin necrosis, blindness, and I really want to kind of take a survey and see how many people who got in filler actually knew that before they got it. But you have to be informed. It's okay to take risks in life, right? Every time we step out of the house, we take risks, but we take informed risk. We know there's a risk, but then the benefit outweighs the risk, and we try to do everything in our power to mitigate that risk, right? Take a risk, but take an informed risk. Be aware and ask those like kind of questions that you need to ask. Other question that everybody asks about filler is usually the difference between Botox and filler. And I feel like people equate these things together as one thing, but they're very different procedures. There is very few that could go wrong with Botox, despite the fact that, you know, you may have a droopy eye for like 4 or 5, 6 months, or not be able to drink or pronounce certain words. Those are side effects, but the bad side effects are really rare with Botox, whereas with filler, it's a whole nother ball game, and we can't put Botox and filler in the same group usually. That's my opinion. If you don't know what questions to ask, and if you're kind of like, I don't know how to judge this person, just replace fillers with a surgical procedure. Say, if I was going to have a nerve surgery, if I was going to have a shoulder replacement, would I trust this person to do it for me? After all, it's a medical procedure. Ask yourself, if I was going to have a shoulder surgery, would I trust this person? And if the answer is yes, go ahead. If the answer is no, I would never let this person cut into me, then no, because they are actually cutting into you.
Dr. Heidi, thank you so much for sharing all of this information and knowledge. And Dr. Heidi, I know that I'm subscribed to you on YouTube and on Instagram and TikTok. Where can people find you if they want to ask more questions or send you a couple of video requests?
Thank you. I'm at Dr. Heidi Goodarzi on all platforms. So I would love to get questions because, you know, our time is limited, and we like to, when we put time, we like to make sure that it's something that patients actually, or people actually have questions about, so it's useful to them. So I'm not doing this just for fun. So I usually, every time someone sends me a medical question, like I had one about vitiligo today, I was like, okay, I'm going to make a video on vitiligo so that hopefully it could help people. So yes, ask questions, ask anything you want, and then I'll try to answer it in a more broad way to help more people. But thank you, Cassandra. This is so helpful. And thank you for using your voice to spread the right messages too.
Oh, well, thank you. No, I appreciate the knowledge that you bring to the table, your expertise, your insights, and your honesty. You are extraordinarily honest, which I really relate to and respect. And on top of that, a lot of what you say is unfiltered. You give people the actual facts. You don't sugarcoat things. That's why we get along.
That's why we get along. Yes, I'm a little bit too honest for my own good.
No such thing. It's why we love you. You guys, if you're not subscribed to Dr. Heidi, fix your priorities. If you really care about dermatology and skin science, her channel is the place to be. And Heidi, we'll see you on the internet, and hopefully not in the OR.
Thank you. Bye.
Bye.